Hi, guys, and welcome to UAE Trailblazers here on Khaleej Times. And, we have this topic that is often not spoken about. We see veterinarians as these saviors to our furry friends at home, to our beloved pets, to our wildlife. However, do we rarely see the humans behind the profession? And today we have Dr. Sergio Da Silva.
Yes.
A vet who is originally from Brazil.
Yes, I'm Brazilian.
Yeah. Who is here in Dubai. And you're going to tell us a little bit about things we don't often get to hear about, right?
Yeah.
About the veterinary profession, about the vets themselves,
Yes.
and what you guys often go through that we don't really see because we don't have this one-on-one interaction often with vets.
Yeah, with the doctors, vets, yes.
Yeah. So please, Dr. Sergio, introduce yourself to our audiences.
Okay. Hi, guys. My name is Dr. Sergio Da Silva. I'm Brazilian, and I have quite a good experience, international experience. I have been working in UK, in Ireland as well, specifically in Ireland, Dublin, as an international wildlife consultant. I have been working in several countries, like I give consultancy and consultation in Morocco, Algeria, Kuwait, Iraq, Iran, I don't know.
A lot of places.
Around 25 countries, from Northern Africa to Central Asia. So, and I'm in Dubai, based in Dubai since 2008.
Nice. Okay.
So, yeah.
So how many years now? 2008? You've been here for
16 years.
16
yeah.
years. All right. So have you seen any differences in the profession in terms of, here in the UAE versus outside?
Yes.
Yeah?
Yeah, I feel that in one way, we are beyond something. We are ahead of some trades in the world.
Okay.
So this is very good for Dubai, but
Yeah.
we're still a little behind because of sometimes a lack of medication, sometimes because it's a new country and the profession is still coming and there's a new necessities for the country itself. So for example, when we talk about the wildlife stuff like that, we still need to import quite most of the product that we need to supply the chain. And for pets and animals in general in UAE, I believe we have enough. We have enough.
So as somebody who has extensive experience in the veterinary profession, can you give us a little bit more insight into what it takes for somebody to become a vet in terms of the day-to-day kind of struggles or what does a vet go through?
Of course, this is my opinion. I believe to be a truly vet, we need to understand that 100% you're not like this fluffy word only.
Yeah.
Okay. So it's not only what I call a happiness clinic.
Yep.
So it's more about healthcare. So first of all, doctors, vet and doctors, human doctors, we have to work together to see how we improve healthcare in our system. We talk about all over the world.
Yeah.
We talk about dengue or cholera or toxoplasmosis or something in humans. That some pregnant girls just always come back to me and say, "Oh, my doctor asking me to give up my cat. Is this for real? Yes or no?" So we have to have a knowledge to impact because we impact a family. When you give your opinion, so you can lose your cat. Cat is not anymore just a cat. It's part of family. So it's a member. So once you have a baby, is the second member of the family because your first member was a cat.
100%. And actually what you're saying rings very close to my heart because we had a cat that we had to kind of give away to a shelter because my mom was getting sick from the cat. And we actually didn't know where to go. We didn't know whether to go to a doctor, like a vet. We didn't know how to kind of solve this issue. So the fact that you're saying that is actually, I think it's really important for people to know.
We need to work together because I believe for the new world, for now on, it's very easy to communicate with people through WhatsApp, to message, to call each other. So I feel that doctors and vets are not enemies. We are not like, we're complementary for something that's more important is the human being. So we work together in beneficial of people, in beneficial of the animal itself. So that is the important thing that I feel.
Yeah.
So in this way, if you want to be a doctor, you have to understand that you're part of the family and you have to work out more hours than even the pediatrician, for example.
Yeah.
Because people call me in the middle of the night. I receive 300 messages in the morning.
Wow.
So that's impossible
From pet owners?
from pet owners.
Just asking you, what's wrong with my pet?
I need to bring my cat to you. Okay, bring the cat. Don't lose your time. So it's impossible for dogs. So we are constantly under pressure, and you have to show your love. You have to show that you is
100%.
important with the animals, important with the family, but you need to be part of the family.
Yeah.
Yeah. So
And I think you guys have maybe this, it's a harder job, I think, because you really do have to show that you care. Because, somebody can accept somebody can accept a GP not really caring about them too much, but with their pet, it's different. It becomes more personal.
yeah.
Yeah. So tell us a little bit, something we might not know as clients or as audiences about the veterinary profession, because I've read somewhere where it says more than 49% of vets feel like they're underappreciated.
Yeah.
Do you think that's true?
100%. But this is part of professional. If you choose your profession, you need to, before to choose a profession, you need to understand how the business is going, because we are the guys who give always the bad news. So that's always we have to come back to the client and explain that we are part of the solution, not part of the problem. So, and explain this about, you have to explain with knowledge, very professional, because either you give a big bill, or you can say that I cannot have you today because I have no knowledge, or you have to say, unfortunately, your pet is dying, for example. But you need to understand and say that is the professional. Always explain my clients. Look, first of all, we have interaction between the client, animals, and the doctors. So doctors in your side. It's like a tripod. So if let's say any pet. So if the doctors has the good knowledge, choose the right medication, it's well dedicated, this is 30% of the health or to save the animal. 30% is comes back from the client. It's very common clients come back to me and they say, my animals is not improved. When you talk to the nannies, for example, the babies or the kids, they say, my mother is not giving the medication for the animal. So it's not only about money, but how to manage the medication at home or to understand how to do the stuff. So this is the other 30%. But the most important is interaction between the animal and the medication and the treatment. But sometimes I have to give the bad news, even if you give the best medication for the animals. So if we are well dedicated 24/7, but sometimes it's the end of the story. And we need to come. So that's come pressure, because the client, they tend to come back to you and they go back and they say, I heard that someone in some place in China or in Brazil has the treatment and you fail on that. Say, no, we didn't fail. So we have to go. This is part. So
sorry, before we go to the next point, I just want to say, so what you're saying is that, for example, the clients or the pet owners are usually sometimes failing to give the medication to the pets.
100%.
And they're not relaying that information to you. So that makes your job way harder.
Yeah, exactly. So most of the information that's come from the pet owners, most of the times it's they try to transfer the responsibility of the animal to you. So it's very common they come back to me and they say, hi doctor, but my cat or my bird or my dog dies with you, I brought to you. And he dies with you.
Okay.
So, and you say, yeah, but you brought to me basically a dead animal or last stage. It's very common also, the pet owners, they come back to us and they say, if getting worse, I bring to you. Actually, it's the opposite. So how to dealing with this, the doctors deal with this, that's how the professional has to be trained. Because I talk about all over the world, because I was in Ireland. I did research with the Pasteur Institute. So I have the very good contacts around the globe. So the knowledge that the doctors has at the moment is a lot.
Yeah.
But sometimes we have a lack of communication in between the doctors and the patients. And also, of course, I'm talking about patients, talk about the client. So we need to deliver it. And that has come for the pressure, it's come even higher. So, but this is part of professional. If you choose that profession,
it's got to come with it.
Yeah, this is a package. You don't have only fluffy animals. You have this
dealing with
health,
the client, 101. Yeah. So what message would you give to pet owners in terms of, when to bring their pets to the vet and when to bring them in terms of, I wouldn't say to make your life easier, but to kind of increase that communication between vet and client.
No problem at all. Look, there's, especially in UAE now, there's a lot of clinics we do package, for example, and it's very good to have, preventative is always better than, safe than sorry. It's always better safe than sorry.
Yep.
So what it means. So if you feel that your animal, let's say he's just, vomit or have some sign or symptoms of bloated stomach. Doesn't matter which animal is it, dog, cat. Come to the doctor because it will be just a consultation, probably a couple of medication.
Yep.
And this is not to make my life easier, but to make the animal's life easier. First of all, animals doesn't speak.
Yep.
As far as I know.
Yeah. As far as we don't know, but yeah.
We don't know yet. Yeah. But they don't talk. So, and we as a doctor, we're well trained to suggest treatment before. So what's happened generally with the consultations, it's we work with fire.
Yep.
So
like it's a risk, you mean, in terms of
the owners bring to us only. Most of them bring in the last stage. It's not common, not only in Dubai. I can talk about Ireland, UK, Brazil, Morocco, everywhere. So they basically, they bring the animals to us on the stage that I say, okay, I'm convinced that my animal is really sick.
Yeah.
So now as I will pay the consultation, so now I can give my responsibility to that doctor. So and that's his come the pressure. The other pressures come from Google.
From Google?
Google. Dr. Google is very good. And by the way, if I want to make money, it's always good to listen what Google say. Because even water is dangerous to drink, if you Google. So don't listen Google.
Okay.
And sometimes the clients, they study the case much more than even us. So that's the doctor has to be aware to say, this is not my domain.
So they overdiagnose basically what's happening with the pet?
Sometimes the doctors, sometimes the client come to you with the knowledge about, for example, FIP. It's one not new disease, it's disease that is basically corona in cats. The corona in cats has 4 forms. I don't want to talk about the stuff, but just to give a... And so one of the forms is FIP, feline infection peritonitis.
Yep.
So most of the animals who are under this condition, the client itself, they know much more than the doctor itself. So why they consider my clinic one specialist in FIP? Because I have to study this every day. And by the way, I'm not considering myself a specialist.
Okay.
So I just work well with the disease. But we do all the protocols, A, B, C, D, and we're dealing very well with the. So they come to you with everything in the paper. So they say, the animal was diagnosed in that clinic. I know that medication is this X milligram per kg.
Okay.
I want to use this, and that, and you have to do this for me. And that's the time that the doctor has to say, come on, calm down.
I see.
Stop, because I will work with
you. Need to diagnose him first.
Of course, first of all, I need to diagnose to see if this is right or wrong.
Yeah.
And second, I believe what is in my experience, I don't need, for example, do I need to do blood tests every single day? Sometimes yes, unfortunately. Sometimes no. So in that case, when they have this kind of chronic case of disease, we as a doctors, we need to work as a consultant, because no one, even if I have a millionaire guy on my back, no one wants to pay 50,000 dirhams bill for a cat, or 100,000 dirhams for a horse, or whatever. So we have to understand that, on the opposite side is not only a walking credit card, as a person.
100%.
So we need to work on this stuff. So the balancing between the bills and the knowledge has to come. So Dr. Google, when they come to us, sometimes they give a very bad reputation for the doctors. Why? Because the client believe that they know more than you.
That they know more, okay.
And if they know more than you and you don't know, please tell them, it's my limit, really.
Right.
I really am sorry.
Yeah.
I know about dogs, I don't know about, but that disease, I really don't know. I point you another clinic. And that's why a lot of people know me in Dubai, because I'm okay to tell guys, that guy is better than me on that condition.
Okay. Go here. This is better fit for you.
I'm not cardiologist. I can detect the problem. I can say, I want to go for that doctors on that veterinary clinic. No problem at all. Okay. I transfer many cases. And I believe that's why my clients are so close to me, because I'm very honest. I tell them, this is not my domain. I don't know about this one.
No, that's good. I think that's an honest approach.
Yeah.
So we've mentioned basically one of the pressures is managing client expectations. Yeah. And then the second one would be kind of maybe over-diagnosing their
100%,
pets.
yeah.
And then is there something else that is, you would say, a struggle for vets to deal with other than
sometimes a client that this is a behavior. I observed this one more in Dubai than in UK, for example, or in Ireland or in Brazil. So what's the behavior? The client wants the results now. And sometimes they tell you, do you know who I am?
Okay.
I am that person, I know that person. And unfortunately for some of the guys, I also know many people in Dubai. So everybody in Dubai is well connected.
Exactly.
So, and this is, don't bother me. But this is the way that just to tell people, but this is too much sometimes. So, for example, I start to medicate the animal at 9 o'clock. At 11, they want an update. So I cannot give an update. How come? 2 hours?
It's
we work on the animal.
That's a pressure. That is pressure.
So, and they go back and call at 12. So when they pressure the reception to say, why the doctor not calling me? What's going on? What's happened?
Okay.
And the reception is under pressure. So the reception come back to me and say, guys, please just tell them that we work on the animal. When they have any different result, it's still the same.
Yeah.
So people call at 11, 1, 2, 3, and they go on and on until the whole day. So if I say that we have the same case stable from the morning, they are happy.
Yeah.
So now the client wants to remove the cat or the dog from us and move to another clinic, and that is, and this happens sometimes.
Okay.
But this is the behavior that I have see multiple times in Dubai. Not only in my clinic, I've been working different clinics in Dubai, and even when I was in the government, we have this kind of pressure.
Right. I mean, that is part of, like you said, it's part of the job. But at the same time, it is stressful because at the same time you're dealing with the people. You're not dealing with the animals. I guess it might be even easier because they're not communicating in a negative way. They're just wanting to be saved and they want to have them receive the medication.
That's the. I feel that what my feelings for Dubai, I can handle the story. So what's happened in some case, I'm sorry to say to the client, I don't want to have you anymore in my clinic.
Yeah.
So, but to have the experience to tell this to the client,
that's tough.
Yeah, it's tough.
It is
but
hard.
you have to. Sometimes you have to.
Okay.
Every big company in Dubai or around the world, you sometimes say, I don't want you as my client.
Yeah.
So when this reduces the pressure, and don't misunderstand me as a tough person. No, I'm very kind, and people know me as a very doctor way of life. You know, I want to save animals. Sometimes people doesn't have money, and I do for free, and I keep saving animals. And if I see animals on the middle of the street, I take them as well. So I'm very a true doctor, a true vet. I'm
like
compassionate
towards
person. I like animals.
Yeah.
But in other way, you need to reduce this pressure on my employees as well.
But that's why we're here to talk about this, because at the end of the day, you are human.
Yep.
And there is a threshold to the pressure that one can take. Let's talk a little bit about the kind of medical community at large. How do you feel like veterinarians are recognized in the medical sphere? Do you feel like they get the respect and the recognition they deserve?
It depends on how you treat yourself. I believe my clientele, they really like me because I'm very honest. I believe we need to be honest. And of course, there's people, even Christ cannot,
Yeah.
he didn't agree with everyone. So anyway, so we need to work out on this pressure, for example. So I feel that the clientele, it's how can I say? Can you cut this part? And come back
It's okay. Yeah, that's fine. That's fine. So the question that I have is like basically, how do you feel about being a vet? But we already discussed that. So I said how vets are recognized in medicine. So that was the question. Basically, how do you feel like you're recognized in the medical realm? Amongst other doctors, amongst
the community itself.
Yeah, and the community itself.
The doctors that they have a good knowledge. If you have to respect yourself and try to give to the community and the animals itself something that is good. But in general, I talk about the profession around the globe because I have been in different countries, at least 25 countries. So just to do consultancy or have visit or do some job. I feel that the doctor is not well respected.
Really?
Yeah.
Okay.
Especially when you see some people who has more knowledge or more have more money, basically rich people to come to us. Sometimes if they belong to some specific community, they come back to you and they put a finger in your face and say, is it your fault? And you have to deal with that. So that's why I feel.
So you feel the lack of respect comes more so from the client rather than the community?
Yes, the community itself respects the doctor very well. When they say I'm a doctor, people say, oh, very well, let me do with this and that. My cat. Actually, it's good for me when they go to parties to don't say that I'm a vet, because the people start to talk about the animals. It's very common, very nice. I love, but I don't want to be
this. It's too much, not all the time.
Yeah, no, I don't want to be the center of attention all the time. It's good to just relax, have a beer, and and chill. But it's very common people come to you and ask in the good way. But in general, around the globe, I see that the doctors are not well respected, and especially for some situation that the client try to literally push you and transfer responsibility. They say, I brought the animal to you, I have that situation for you, and you didn't give me back what I expected.
Yeah.
As far as I know, we cannot do miracles. So that's that. But community-wise, community, I feel the community itself, it's respecting us. But unfortunately, we are suffering from burnout syndromes.
Yeah, so talk to us a little bit more about that, the burnouts, because burnout, it is a problem these days. We're all working around the clock all the time. Yeah. What is something that causes burnout in veterinarians? For veterinarians?
I believe, first of all, veterinary field, it's one of the professions that you choose by heart. Sorry to say against any other profession. Guys, don't misunderstand. But because first of all, you have to work extensive hours. Most of the time, after hours, when I talk about, you can ask my wife anytime, 10 o'clock, 11 o'clock, 6 o'clock in the morning. What I truly understand, it's this pressure sometimes it's killing people.
Yeah.
Besides this one, we have too much information come from different media, for example. You have Google all the time, punch your head. You have LinkedIn. You have WhatsApp. It's making people crazy nowadays.
Yeah, 100%.
So it's the message, and sometimes people are very aggressive. They put question mark if you don't answer in 2 or 3 minutes after that. And I'm doing surgeries, for example.
Do you give your clients your phone number?
Some clients, they have my number.
Okay.
But, and by the way, even if I didn't give my number for some clients, the vet's number is like I'm saying, a pediatrician. So somehow people get your number.
We'll find it.
They find a way.
Yeah, they'll find it.
I don't mind to answer my phone. I don't, but they need to understand that, for example, mornings, I do surgeries.
Yeah. Okay.
So I cannot answer the phone in the morning.
Yeah.
So afternoons, I have to check my patients. And I have consultations. So
lots of messages coming after.
Yes, how come? Imagine 300 messages in the morning, 1 minute each. I'm talking about 5 hours. And if I have to answer these people back again, it's extra 5 hours. So my whole day is only on the phone. So
that's tough. That is really tough. What do you do to balance that out? What do you do? Is there any practices? Do you turn off, you put your phone on airplane mode? What do you do?
No, I turn off. I really turn off.
Turn off. Okay.
9 o'clock is my limit, evening time. And I turn on at 8 o'clock in the morning. Because especially when I start the company, I opened the clinic on 2021. Actually wasn't in my plans to open the clinic. It just came as an opportunity and I did. But I have to pumping people in the clinic. So of course, a lot of people, especially the Brazilian community, Portuguese community, has my number.
Yeah.
So they start to message my private number to come to me.
Okay.
So of course I allowed, because it's the beginning of any practice has we have to get the contact, needs this stuff. So and after this becomes too much. After 2023, I can say it's too much. So my secretary handled my mobile.
Okay. That's a good idea.
Yeah.
Yeah.
I give my number to my reception, so they handle my mobile. And after 9 o'clock, I just turn off, and that's it.
Okay.
And I can say for the next couple of months, I can say 2 or 3 months, because I'm planning very well the steps. So I can say September, I start to only have clients until I can say 5, 6 o'clock afternoon maximum. And after that, I have to...
Okay. So it seems like what you're saying is time management is really important. Also outsourcing, for example, the messages in the WhatsApp, you can put it onto the receptionist, your assistant, someone to help. A support system is very important. Yeah. And I think this is really good information for new vets, someone just going into the field right now, somebody young and eager and who is wants to do everything. But at the same time, you're trying to prevent burnout and you're trying to prevent an overload of information. So
I believe the doctors, we don't know how to lose the animals. Because of we really love the animals, we really like. Most of the doctors, I can say honestly with you, most of the vets are very passionate about their profession and they really want to help. Okay, some guys come to the field because they want to do doctors. They want only the medical field. But most of the vets go into the field to be, kind of this, startup. How my story about how I started to do the vet. I was saving animals since when I was 5 years old, make my mother crazy, and take animals and pigeons in the middle of the street and cats in the middle of my neighbor and any dog that I see in the street, I want to pick them up to my house. And that's how I started this stuff. I was doing my house. And after, of course, 18 years old, I started work studying as a vet and did my master, all this stuff. But I feel that the doctors, they don't know how to lose because we feel the same as the animals feeling, and especially with the clientele, we put ourselves in their position.
That is really hard. So basically you have to deal with loss more than...
And we don't. And we are not prepared. Human beings are not prepared to dealing with loss.
Yeah. Because at the same time, you're sad for you are naturally going to be upset and disappointed and sad that you couldn't save an animal. At the same time, you're feeling for the client.
Yeah.
A lot of emotions.
Yeah. Because we are not well prepared for this one. I feel the veterinary schools are preparing us very well to have knowledge. Because we are not studying only one species. So for example, the doctor, they study one species. And after that, they do the residence and do psychiatrist, pediatrician, stuff like that. Doctor, we go for, me in the consultation. My clinic is like an ark.
Yeah.
I have received wildlife animals, different ones.
All the wildlife.
Yeah, different ones. Birds and small pets, exotic animals. So we have to deal with all of this. So imagine hamster has 2 years old.
Yeah.
So he has 2 years life expectation. So if you talk about the parrot, it's 70 years life expectation.
Wow, really?
Yeah. So cats 15 to I can say maximum 20. So dogs, depends of the dogs. The big dogs 10, 12. Like a Molossus dogs, like a Dogo Canary or Mastiff is 10 to 11 years old maximum. Small dogs, 18, 19 maximum. Yeah. So you have to deal with this, expectation and explain the client. And they always want to convince you that you, Dr. Sergio, can save my animals for extra 2 or 3 years.
Yeah. So let's talk about the support that vets need. Where do you think it can start? Do you think they can receive it from the actual vet community where you can go and, talk to somebody, have a support system, or does it start at schools? I mean, I think we need, you guys need, is from what I'm hearing is that you really need that support.
Yeah. I believe it's a kind of, because the veterinary profession from the last 100 years moved for something that was kind of, side by doctor.
Yeah, like a supplementary kind of.
Yeah, but if we read the history of veterinary field, so just to give an example, so from from Egypt, the kings, the physician or the doctor that take care of the Tutankhamun, for example, was the same guy who take care of the horse.
Ah, okay. So he's just doing everything, mixing and matching. Each other.
So just to give one interest highlight.
Yeah.
So we need support for everywhere, but I believe we need to respect ourselves. So exercise is important for us.
Okay.
I believe we need to go for chill out. go with friends. Yeah, it's very good to have friends.
Disconnect.
Disconnect a little bit.
Definitely.
This is extremely important. And go only for inside of community. I believe this is a mistake.
Yeah.
I believe we have to do the opposite. Okay, my name is very good in this community, in UAE community. Even if we're abroad, people know me. But we need to disconnect, especially for exercise.
Nature is a very important.
Walk outside.
Walk outside.
Go for some beach or some, I don't know, some desert. Just take your dog and walk outside. It's good enough just to breathe some fresh air. So I feel that this is the beginning. But if you have some psychological support, psychiatrist or psychologist, I believe this could be a good help.
Yep.
Not because you're crazy, we go crazy, we burn out. Just normal, part of life.
Yeah.
We need sometimes to sleep well, and
100%.
And this is the support.
So just to kind of wrap this up, because we've received, there's a lot of information about this. And if you could say anything to pet owners or people who, enjoy having animals around them, what is one message that you could give them?
About the doctors or about...
about how to kind of manage their communication with their vets, because usually if someone has a vet, they will continue going to the same vet and they will continue having that, they will trust them with their animals. And like you said, the animal is part of family. What is one thing you would say just, in order to have that like kind of healthy relationship between vet and customer?
Build a relationship. It's better than just asking for how much it costs to build.
Yep.
I believe this is the best, because build a relationship, it's like anything in the world. Yeah. We are human beings. What's the differentiation between us and, I love my animals, but we have a communication.
Yep.
So build relationship is the most important. So if you build this relationship, you have the best friend, your doctor, because he'll be close to you. Community vet, I believe this is the best. And the client, please don't go for Google. Just, this is I'm not against Google, please, guys. But it's, come to someone that you trust. That's why I'm saying build relationship.
Yeah.
And Dubai is very good for this. We have people all over the world. You can speak Portuguese in my clinic. I have different people who speak Ukrainian, Russian, French. And so we're an international place. So we need to build this relationship.
100%, I agree. Thank you so much, Dr. Sergio. This was a pleasure. And I really hope everyone, got valuable insights. I'm sure they did, because you really did shed light on some things that we would not think about, or would not know, I think, in terms of the veterinary realm and the veterinary profession. So thank you very much.
Thank you for the opportunity. Thank you for my clinic and all of you, my wife and my kids. Thank you, guys.
Thank you. Okay, guys, if you enjoyed this video, do like, share, subscribe, or just say hello in the comments, and we'll see you on the next one.